Good morning, students. Welcome back to Pharmacology Made Simple. In today's class, we will be discussing about the next topic regarding adverse drug reactions. So in today's class, we'll see about teratogenicity. Teratogenicity is the ability of a drug to cause fetal abnormalities when administered to a pregnant woman. Teratos in Greek means monster. The sedative thalidomide taken during early pregnancy for relief from morning sickness resulted in thousands of babies being born with chomelia, that is seal limbs. This thalidomide disaster during 1958 to 61 opened the eyes of drug licensing authorities, and various nations made it mandatory to conduct strict teratogenicity tests before a new drug is approved for use. So here we see an image of a baby who is born with the seal limbs, chomelia, because of the thalidomide which was taken during the early pregnancy. Okay, so what is teratogenicity? It is the ability of the drug to cause the fetal abnormalities when administered to a pregnant woman. Therefore, it is very important to know which drugs can be taken and which drugs should not be taken during the pregnancy. Depending on the stage of pregnancy during which the teratogen is administered, it can produce various abnormalities. The first one is conception to 16 days, usually resistant to teratogenic effects. If affected, abortion will occur. And the second one is the period of organogenesis, that is between 17 to 55 days of gestation. Most vulnerable period. Okay, so this is the most vulnerable period in which the drug can cause the abnormalities in the baby, where the physical abnormalities will occur. And in the fetal period, that is 56 days onwards, is the period of growth and development. Hence, developmental and functional abnormalities may result. Okay, so throughout the pregnancy, during different stages, it can produce different abnormalities in the child. Examples of drugs affecting various organ systems. The organ system affected, and the examples are given over here. In case of hepatotoxicity, that is, there will be the abnormality in the liver. The drugs which will cause it is isoniazid, pyridoxamide, paracetamol, chlorpromazine, ethanol, phenylbutazone. And nephrotoxicity, that is the damage to the kidneys, can be caused by analgesics, aminoglycosides, penicillamine, gold salts, cyclosporin, and cisplatin. Ototoxicity could be caused by aminoglycosides and furosemide. Ocular toxicity, that is in the eye, it could be caused because of the chloroquine and ethambutol. In the GI system, it could be affected by the opioids, broad-spectrum antibiotics. The cardiovascular system can be affected by drugs, that is digoxin and doxorubicin. The respiratory system can be affected by drugs such as aspirin, bleomycin, busulfan, and methotrexate. The musculoskeletal system can be affected by drugs such as corticosteroids and heparin. And the neurological system can be affected by drugs such as haloperidol, ethambutol, quinine, doxorubicin, and vincristine. Okay, so different drugs can cause the toxicity of the different organs, or it could affect the different organ systems. Therefore, in general, drugs should be avoided during pregnancy, especially in the first trimester. The type of malformation also depends on the drug. Example, thalidomide causes comalia, which we've already seen, and tetracyclines cause deformed teeth. Some teeth may be formed and some teeth may not be formed, and some teeth may be large, some teeth may be small. So there will be the deformity in the teeth formation. And sodium valproate is a drug which can cause the spina bifida. Spina bifida is a condition in which there will be the outgrowth of the vertebral column, and it can also lead to meningomyocele. Next, we move on to drug interactions. What is drug interaction? It is the alteration in the duration or magnitude of the pharmacological effects of one drug by another drug. So what happens? It alters the duration or magnitude of the pharmacological effects of one of the drug due to taking another drug at the same time. So what happens when two or more drugs are given concurrently, the response may be greater or lesser than the sum of their individual effects. Such responses may be beneficial or harmful. For example, a combination of drugs is used in hypertension, that is hydrazine and propranolol, for the beneficial interaction, but unwanted drug interactions may result in severe toxicity. So here we see the image of a drug interaction. So when a drug is taken along with other drugs or with food or with supplemental drugs, or in case of different medical conditions, the possible effects could be the decrease in action of the drugs or the increase in action of the drugs, or it could cause the severe adverse effects. Coming to the site of drug interaction, the drug interactions can occur in two sites, that is in vitro and in vivo. In vitro, in the syringe before administration, mixing of the drugs in syringes can cause chemical or physical interactions such drug combinations are incompatible in solution. Example, penicillin and gentamicin should never be mixed in the same syringe. Okay, this is very important. While giving the drugs, you should not mix two drugs in the same syringe and administer it. Okay, and in vivo, that is in the body after the administration, the reactions will take place. Coming to the pharmacological basis of drug interactions, the two major mechanisms of drug interactions include the pharmacokinetic and pharmacodynamic interactions. In pharmacokinetic mechanisms, alteration in the extent or duration of response may be produced by influencing the absorption, distribution, metabolism, or excretion of one drug by another. So in absorption of the drugs from the gut might be affected by the binding factors such as tetracyclines chelate to iron and antacids, resulting in reduced absorption. Whereas cholestyramine is a bile acid binding resin which also binds many drugs. Okay, so the binding capacity of the drugs could result in its absorption, reduced absorption or increased absorption. Okay. Next, we see the altering gastric pH. Antacids raise gastric pH and interfere with the absorption of the drugs like iron and anticoagulants. Next, altering GI motility. Atropine and morphine slow gastric emptying and delay the absorption of drugs. Purgatives reduce the absorption of riboflavin. Moving on to the distribution, competition for plasma protein or tissue binding results in displacement interactions. Example, warfarin is displaced by phenylbutazone from the protein binding sites. When two drugs are competing for the same plasma protein, it could result in displacement interactions. In metabolism, enzyme induction and inhibition of metabolism can both result in drug interactions. Example, phenytoin, phenobarbital, carbamazepine, and rifampicin are enzyme inducers, whereas chloramphenicol and cimetidine are some enzyme inhibitors. In excretion, when drugs compete for the same renal tubular transport system, they prolong each other's duration of action. Example, penicillin and probenecid. Coming to the pharmacodynamic mechanisms, drugs acting on the same receptors or physiological systems result in additive, synergistic, or antagonistic effects. All these topics I've already covered and I've already discussed. So please go through it. If you do not know what it is, please see the previous videos about drug additives, synergistic, or antagonistic effects. Many clinically important drug interactions have this basis. Examples are atropine opposes the effects of physostigmine, naloxone antagonizes morphine, antihypertensive effects of beta blockers are reduced by ephedrine or other vasoconstrictors present in hold remedies. Many diuretics produce hypokalemia, which potentiate digitalis toxicity. Also, organic nitrates used in angina act by increasing the CGMP activity. Some drugs, such as the sildenafil, inhibits the phosphodiesterase, which inactivates CGMP and thereby potentiates the effects of nitrates. Hence, the combination can cause severe hypotension and even deaths have been reported. And aspirin will inhibit the platelet aggregation and enhance the risk of bleeding due to oral anticoagulants like warfarin. And many antihistamines can produce sedation, which can be enhanced by alcohol intake. So here we are seeing that different drugs are causing the different effects in the body, and how by taking two drugs in combination, what are the changes which are happening. So the important questions which can be asked from this topic is tetrogenicity for 5 marks and drug interactions for 10 marks. Hope it is clear to you, students. If you do like my videos, please subscribe and share with your friends. Thank you.